Suffering with a disc bulge in the lower lumbar spine, like an L4-L5 disc bulge or an L5-S1 disc bulge, and all its associated symptoms like severe back pain, leg pain, numbness, and tingling into the legs and feet, can be so debilitating, cause a lot of limitation and even disability in one's life, that it's not uncommon to wonder if you can get your life back to normal again. That's the focus of today's episode of Ask Dr. Walter Salubro, episode 25. This is a very special series that I've been doing on my YouTube channel, and what this series is about is I take a question from one of the comment sections and I'll answer that question in a video format just like this, and who knows, maybe your question could be next. So do leave a comment or a question in the box below and perhaps will be featured in the next episode of Ask Dr. Walter Salubro. So let's get right into it. This is a question asked by Filippo, okay? And very simply put and very simply asked, Filippo asks, can I get back to normal after a disc bulge? I can totally understand the concern behind that question, the uncertainty behind that question. I've had hundreds of people in my office with severe disc bulge problems and severe pain associated with disc bulge, trouble walking. I've had patients had to be carried by their family members, sometimes one on each arm like this, and they're literally carrying them down the hallway to our exam room and treatment rooms. I've had patients literally crawl down the hallway because of how much pain they've been in. So when a disc bulge in the low back, like an L4, L5, or L5-S1, is extremely advanced and extremely inflamed, it can cause a tremendous amount of pain and disability and also emotional suffering. So it's not uncommon to feel like, am I ever going to get back to normal again? And the short answer is yes, I believe you can get back to normal again. It may not be an easy journey, it may not be a quick journey, but I believe it's possible. And in many cases, not all cases, but in many cases, it can be done without surgery. I'll tell you the two most common mistakes that people do that may prevent that from happening as quick as they would want. Number one, waiting too long to do some kind of professional treatment, any type of professional treatment. I'm a chiropractor, so I'll talk about chiropractic here, but other forms of treatment may be helpful as well, like physiotherapy, exercise, acupuncture. But what chiropractic offers differently is that it works on the structural correction of the spine and the vertebral alignment, which is where the discs are placed anyway. So you want to make sure that's aligned properly. But one of the most common mistakes I have seen with the patients that have taken longest to get back to normal with their life is they've waited way too long to start care, to at least get a checkup, to do some form of treatment on their spine and on their back, regardless what the treatment is. So if you have symptoms that started fairly recently, do not wait to get a spinal checkup. Do not wait to get started. Look for some form of corrective care, chiropractor, or some type of treatment that can help get you back on track right away. Why is that important? It's because you target the acute inflammation immediately before it becomes chronic and before chronic inflammation kicks in and before fibrosis and scar tissue begins to develop in those injured areas. So it's super important to start treatment immediately. The second most common mistake that I've seen that prevents people from getting back to normal is that they stop their care too early. Whether they just give up because of an uphill battle, or whether they start feeling better because their pain is diminished and they feel like they're back to normal. Just because the pain is diminished in the early phases of care, it doesn't mean that the structural problem in the spine got corrected or stabilized. It can take months and months to possibly get to really good stabilization of the lower back and the spine. So don't stop your care earlier. Follow the recommendations of your chiropractor, follow the recommendations of your therapist, because they've seen this before with many, many other people, and they know that once you follow the recommendations, that the likelihood for a more permanent recovery and less likely for a recurring situation to happen is more likely, okay? So get started as quick as possible with some type of care, like chiropractic care or physical therapy or exercise, under the guidance of a professional practitioner, and don't stop your care early. Make sure you follow through with the recommendations as long as it takes for it to get better and stabilized. So that's the answer to today's question of Ask Dr. Walter Salubro. And again, so I do believe that you can get back to normal again in most cases. Do stay positive. Don't ever give up, because I've seen hundreds and hundreds of people get back to normal again from suffering from a lumbar disc herniation like L4-L5 disc bulge or L5-S1 disc bulge. So that's the answer for today's episode of Ask Dr. Walter Salubro. If you have any comments, questions, or thoughts, do leave it in the comment section below. Who knows, maybe your question could be answered next in the next episode of Ask Dr. Walter Salubro. And if you missed any of the past episodes, go right here to watch the playlist right over there to catch all the past episodes.